Okay, so good evening, everyone, and welcome to the GSU BSPH Concentrations Informational Session. We are so excited that we could host this event today. I am Dr. Elizabeth Armstrong Mensah, Clinical Associate Professor, Undergraduate Program Director with the Department of Health Policy and Behavioral Sciences. And today I will be facilitating the session with a few of my colleagues, and I'm going to turn it over to them to introduce themselves. Yeah, so there you go.
Good evening, everyone. I am Dr. King, and I serve as the undergraduate program director for population health sciences, and I am a clinical associate professor. Thank you for everyone attending this evening.
Good evening. I am Denise Gouveia. I'm the Director of Academic Assistance in the School of Public Health, and just want to welcome you to this session.
Hi, everyone. I am Mayana Silas. I am the academic advisor for the School of Public Health. For some of you, you may not know me. I advise students with 90 credit hours and above, but welcome. Hello.
Okay, so thank you all very much for the introduction. So in the next few minutes, we're going to be walking you through a few things, right? We'll provide you with information on the BSPH major, rationale and implications. We'll talk to you about the new BSPH major curriculum area names, why we came up with the BSPH concentration or why we came up with the concentrations. We'll talk about the BSPH concentrations, careers and salaries, the courses that make up the concentration, who can declare a concentration, some of the things you ought to consider when deciding to declare a concentration, and then we'll open the floor for Q&A. We'll answer your questions. To facilitate this process, I'm going to ask you to please keep your questions, hold your questions, and type them or put them in the chat. And after the presentation, we'll take your questions, we'll answer your questions, yeah? All righty. So I'm going to turn it over to Denise to take us off.
All right. So good evening again. I am going to go over the the rationale and implications of having these concentrations.
Next slide.
Yes. So the BSPH major, for those of you who may have been here before, we had a pre-major, but now we will only have students in the major, and they will not have to go from the pre-major to the major. So I'll start off by saying that. We required students formally to declare a pre-major and then be accepted into the full BSPH major. However, going forward, starting in fall of 2024, this current academic year, the pre-public health major is no longer in the curriculum, and we will be transitioning students out of it. You can enroll in the public health major as soon as you're accepted to GSU as an undergraduate student. Next slide. And the rationale for the BSPH major is that most undergraduate majors at Georgia State University do not require a pre-major. So this would enable students to enroll in a degree program of their choice from the onset without having to go through the gateway of a pre-major into a major. So we've eliminated that obstacle. So implications for us having the major and not the pre-major anymore. We have removed the overall 2.5 GPA that was required to matriculate into the major. We've also removed the 2.8 GPA in what used to be Area F courses, but it is our lower division courses. We require C or better, so that will still be enforced in that preliminary block of courses that you would be taking. So that would be really our introductory public health courses, and undergraduate students must still adhere to the minimum 2.0 GPA requirement to receive a bachelor's degree from Georgia State University.
Dr. King?
And so now we will talk about the major curriculum area names. And so this gives you an idea about how will move forward with the area names. Of course, I am sure you're familiar with the core impacts and what that looks like and stands for the institutional priorities, the mathematics and quantitative skills, the policy, the political science and U.S. history, the arts, humanities, and ethics, communication and writing, the STEM courses, and then the social sciences. So all those add up to the 42 credit hours. And then the 18 credit hours, those are the lower level division requirements, which are your introductory classes, which we refer to as Area F previously. And then you'll also be required to do the additional quantitative methods course, as well as the additional science or social science courses. We'll have still the 33 credit hours for the major public health courses. You will still also have to do the signature experiences, which are 6 credit hours. And then you will have the ability to still have the electives pertaining to that particular concentration, which will add up to 15 credit hours. And then lastly, 6 credit hours for the advanced electives, for a total of 120 credit hours for completion of the undergraduate program.
So, I mean, the question some of you may be asking is, I mean, why do we have BSPH concentrations? Why now, right? And there are several reasons for this, right? So, the School of Public Health has 2 departments, Health Policy and Behavioral Sciences, as well as Population Health Sciences. Now, each department has 2 concentrations offered at various academic levels, right? So the Masters in Public Health program was the first SPH program to be aligned with the 2 departments and created with concentrations, followed by the doctoral program, and now is the turn of the bachelor's program. Now, we also decided to create the BSPH concentrations because having concentrations will give students the opportunity to focus on an area of study within a major, optimize their college experience, and increase their marketability at the for jobs and higher education. And want to go on to talk about BSPH concentrations, careers, and salaries. Yeah. So the GSU School of Public Health now has 2 BSPH concentrations. The first is Health Policy and Behavioral Sciences. Second is Population Health Sciences with a pre-med track. And as we said already, a total of 120 credit hours are required to obtain a degree in this program. This has not changed, it's still the same. Okay. So I'd like to go on and talk very briefly about the Health Policy and Behavioral Sciences concentration. By way of description, this concentration provides a framework for understanding the cultural, social, political, and economic determinants of health and health equity, with a special emphasis on racial and ethnic minority and marginalized populations. The concentration focuses on health behavior, health systems management and healthcare delivery, social determinants of health, and how existing inequities can be addressed at the organizational, community, and societal levels. Students who engage in this concentration will be trained in the principles of health management, policy and administration, as well as program evaluation, advocacy, and effective health communication. The objective of this concentration is to provide students with requisite knowledge and skills to support the design and evaluation of public health programs and policies in a variety of settings, right? Advocate for change through the promotion of best practices to improve health, assess healthcare delivery, and more. Okay. And we are hoping that by the time students have gone through this concentration, they will be prepared for, the workforce as well as for higher education. I want to spend the next few minutes also talking about potential careers and salaries that students who choose this concentration could attract. So students who choose this concentration could become a disease preventing specialist and earn an average of $58,000 per year, or they could become a communications specialist and earn up to about $88,000 per year, according to ZipRecruiter. This is not according to me, it's according to ZipRecruiter. Or they could become a public health specialist and earn up to $63,000 according to payscale.com, to mention a few. So I'm just going to turn it over now to Dr. King to talk to us about population health sciences.
Thank you, Dr. Armstrong-Mensah.
Mhm.
So the concentration for the population health sciences will prepare students to integrate knowledge, theory, and tools from many disciplines to broaden the understanding of the many pathways that produce health and health disparities at the population level. And students that are pursuing this concentration will seek to understand how the health of a population is impacted and what interventions can be used to improve health and reduce disparities. The objectives for this specific concentration include recognizing the concepts of population health, explaining the basic processes, approaches, and interventions that identify and address the major health-related needs and concerns of populations, and identify the social, behavioral, biological, and environmental factors that impact human health, and to identify social, behavioral, biological, environmental factors that contribute to health disparities. And one thing that I really want to point out with this specific concentration is this concentration tends to have a curriculum that is more focused on science-based materials to meet the needs of students who have an additional interest in the natural sciences. And it is more aligned with laboratory career-based pathways, pre-professional career pathways, or either a clinical setting.
Next slide.
Yes, please. And so this slide gives you an idea about some of the career pathways that students may end up in after they complete the concentration in population health sciences. And so you can see here, like I said before, this particular concentration is definitely more aligned with natural sciences. And if you want to take a more clinical pre-med track as well. So this will definitely set you up for medical school, dental school, PA school, because you do have that those electives there as well. So this just gives you an idea. You see an environmental science there, emergency management director. So yes, this just gives you an idea about the wide, broad pathway of career choices. There.
Dr. King.
Go ahead, next slide.
Yeah, I'm on the next slide. Concentration courses.
So now we are getting ready to talk about the similarities as well as some of the difference between the two concentrations. So in general, every student, no matter which concentration that you choose, these are 33 credit hours that everyone will take. And so you can see them listed here. And once again, no matter what concentration that you choose, every student will take these 5 core classes that equal up to the 33 credit hours. Next slide. If you choose to go the route of population health sciences, in addition to the courses that you just saw in the previous slide, you will also take these courses here. So you will take the chronic disease epi, fundamentals of environmental health, introduction to chronic and infectious disease, introduction to public health emergency preparedness and response, and introduction to work safety and health. So this is 5 classes that you will be taking in addition to the previous slide, the 33 credit hours that once again, everyone will take. So if you choose the population health science concentration, these are the 5 specific classes that you will be responsible for completing.
Thank you, Dr. King. So on the screen are the 5 additional courses that BSPA students enrolled in the health policy and behavioral sciences concentration will have to take. And each of these courses accounts for 3 credit hours, right? So you will take the social and behavioral dimensions of public health, health equity and disparities, urban and global health challenges, introduction to public health informatics, introduction to public mental health, and then introduction to health management and administration. Okay.
So, who can declare a concentration? I know that's the burning question this evening. And so all freshmen who are incoming for the 2024 to 2025 academic year, so that would be students who started in fall of 2024, which is this semester, going forward, must choose a concentration and they can declare it. Some of you, if you are on this call, you are probably still a pre-major that we're getting ready to flip into one of the concentrations. And so also students who are already enrolled in the BSPH major may declare a concentration as well. And then we'll have more information about that coming up.
So what to consider when declaring a concentration? You can go to the next slide. So most importantly would be your graduation date. This is particularly important for students who are on the previous catalog. So if you select a concentration, this could extend your time in the BSPH program. If you are at least halfway through. So some of the courses that you've completed may or may not be applied towards the concentration that you select. In this case, you can petition the department to apply those courses as your advanced electives. However, it's also important to know that if your elective space is already completed, those courses would not be applied or would not count towards your degree program. Also, it is important for you to select a concentration that aligns with your academic interests. I always tell my students when selecting a major that you should always start with where your interests lie, and it should be the same when you select a concentration. Students tend to perform better when they're interested in the coursework, so yeah. Also, I would encourage you to visit our website. On our website, there's information about careers for each concentration, and also taking a look at the list of courses for each concentration as well. When you're in DegreeWorks, there is a tool, it's called What If. If selected, you will see how your courses will be applied if you decide to switch to whichever concentration. You can always schedule an appointment with me. We can go over it more if you don't know how to access it, but it's a really useful tool. So you can see exactly, you know, which courses you need and the courses that you've already completed, where they will count or which area they will count towards.
Okay.
Thank you so much for joining our webinar this evening.